Nick Prevo, RT, and I'm going to show you how to use the Avanos BAL Cath with the Avanos Liberator system. So the first thing to keep in mind is during these times of isolation, I'm by myself, but this is usually a two-person procedure, so there would be another person working with me to make sure that everything flowed smoothly, and because it is a sterile procedure, the extra set of hands are usually very appreciated. So the first thing that you're going to want to do is grab your Avanos 13 French BAL Cath system. Now when you open this up, I know it's tough to see with the lighting, there are a couple different sets of options in here for accessories. The main thing that you're going to need to grab is your catheter and your suction port. The suction port goes onto the end, and you make sure that you have this stopcock closed to suction. So your catheter, again, I would have gloves on. This would be sterile. I would set this down on the sterile surface. And I would need to gather a couple other supplies. Avanos makes a kit which has everything that you need for the procedure already included in it. If you don't have the kit, these are all items that are easily found in an ICU. So the kit consists of two 60 milliliter syringes, a blunt tip needle, a Lucan's trap, cap, and 2 vials of saline. So what you would do is obviously attach your blunt tip needle, draw up your saline. You can use anywhere from 40 to 50 cc's of saline, but always make sure that you leave 5 cc's of air behind after you draw it up. So I draw up both of my syringes. I'd use 40. Set my saline off to the side. I could then take my Lucan trap and connect it to the suction, which is off, and I'd hook this to wall suction. So everything for the procedure would be set as far as materials go. Now I would have this on a bedside table off to the side, and again I would have that other set of hands helping me, kind of controlling that stopcock and the Lucan's trap. Now my patient is on the Liberator system. So before we do the procedure, I would open up the stopcock, I'd pass my catheter down, safely suction the patient out, close the stopcock, and by closing that, again, remember your patient's ventilating, but we have no access to the suction catheter. So when we take this off, there's no de-recruitment, there's no loss of PEEP, there's no breaking the circuit, there's no need to put an adapter in line, which causes a break in the circuit in order to perform this procedure. I would grab the Avanos accessory adapter, mainly used for bronchs, also good for BALs. I can take my suction off, I do this all in one hand, cap it, set my suction off to the side, hook up the bronch adapter, and now I can have this open, nothing's going to leak out or anything at all. My suction can then be safely set off to the side. What I would do is I would manipulate the catheter, taking off the protective tip. Again, I would have the other person holding the Lucan's trap and controlling the stopcock for suction. At this point, I'd attach my syringe. They would be in total control of that. Now, I would insert the catheter, open up the stopcock, and advance. Now, once I get to this inner flange of the ET tube, I give it a quick little quarter twist, and the catheter will advance farther. Now, on this catheter, similar to suction catheters, you'll notice that there's centimeter markings. I want to rotate the catheter so I can see the centimeter markings and line them up with the markings on the ET tube. So as I advance this catheter down, I'm going to line up my 30 with my 30. Then what I'm going to do is keep in mind that this is a directional tipped catheter, BAL catheter. So when we pull this out, the reason that we have to give that quarter twist is that it has a slight bend in it. That slight bend lines up with this little dial on the end of the other end of the catheter, so that whichever way you rotate this, that tip turns. So if I want to be in the left lung or the right lung field, I can manipulate that left or right. So again, do my quarter turn, advance the catheter, line up my centimeter markings. My partner would have control of everything else on the other end. I'd line up my 30 with my 30 just because those are the markings that I can see, and I am at the end of the ET catheter. Now, depending on which lung I want to go into, I'm going to go left, so I turn it towards myself, entering the patient's left lung field. I'd advance it 4 centimeters. I would then flush the catheter by giving it just a cc or 2 little rinse. At this point, there's an inner catheter. I would advance that until I feel resistance. At the point of resistance, I would pull back slightly because I don't want to create a wedge. Then I would be able to have the other person push the saline. Then I could turn this stopcock to suction and allow the specimen container to fill. If for some reason I did not get a large enough amount back, I can turn this off to the suction, disconnect, hook up my other syringe, advance that, turn it back on to suction, and I should have enough for my sample at this point. So this person at this point in the procedure would disconnect the wall suction. It's important to do that right away, so that way your sample doesn't get sucked into the wall unit. While they're doing that, disconnecting the wall suction, the other person can then pull the catheter back. They pull it out, pull it back, and without taking it all the way out, we'd stop, we'd close the stopcock, then we can take our bronchodapter off. They'd have the trap off by this point. This whole unit gets tossed in the biohazard container, and your trap can be taken off, capped, and sent down to lab. We would then take our normal suction catheter, hook it up, and be right back to standard patient care. So the one other thing that I'd like to mention, if you are using this system, is that prior to collecting your specimen, when I said that you could go down and suction, make sure there's nothing obstructing the airway. When you go to pass that catheter, you're not getting anything on the tip. It's also a good idea and recommended to take advantage of the wiping mechanism and deploy the Liberator wiper prior to collecting the specimen to be able to fully clean that tube to make sure that you're not knocking anything down into the distal lung fields or getting a false sample. I hope that that helps, and have a great day.